Hello class. I will be presenting material on Chapter 4 of Ramachandran. I'll begin with a case study of Drew, or DB, who had an abnormal clump of blood vessels surgically removed from his brain, along with some normal brain tissue right next to the visual cortex. This procedure rendered Drew completely blind to the left half of the world. He was able to see out of either eye, but the left half of his vision was missing. During experiments, objects were held outside his field of vision in his blind spot, and although he was blind on the left side, Drew was able to reach out and grab the objects accurately. Drew insisted he was unable to see them, however was able to complete a number of tasks involving grabbing different objects as well as guessing the orientation, either horizontal or vertical. This is truly fascinating, and Drew has been diagnosed what we have come to be known as blind sight, which has to do with the division of labor between the two visual pathways. Drew has lost his primary visual cortex, resulting in blindness. However, his primitive orienting pathway was still intact. Ramachandran explained it as when a spot of incoming light fails to activate the newer pathway, which has been damaged. It then is transmitted through the superior colliculus to other brain centers such as parietal lobes. This is what guided Drew's hand to the objects and allowed him to guess if a bar was vertical or horizontal without being actually able to see them. Lastly, the subjects rarely develop any kind of confidence in their abilities. Even when told of their successes, they would not begin to spontaneously make guesses about objects and would still require prompting. Furthermore, blind sight subjects rarely express the amazement about their abilities sighted people would expect them to express. And what implication does this bring about? That only the new pathway is capable of conscious awareness, such as I see this, and the old pathway uses input for all kinds of behavior, even though the person is completely unaware of what's going on. One other explanation offered to this phenomenon is that even though the majority of a person's visual cortex may be damaged, tiny islands of healthy tissue still remain. These islands aren't large enough to provide conscious perception, but nevertheless enough for blind sight. And one last interesting fact is that there are two different kinds of blind sight. The first one is the one that I've just explained, and the second is when a patient claims to have a feeling that there has been a change within their blind area. For example, a movement of an object or person has occurred. Alright, so Balint syndrome is a rare disorder, but definitely still worth documenting. It usually occurs from a stroke or multiple strokes at the same place in the parietal lobes. The symptoms often include inability to perceive the visual field as a whole, difficulty in fixating the eyes, also known as ocular apraxia, and inability to move the hand to a specific object by using vision, also known as optic ataxia. It causes tunnel vision where the patient's eyes stay focused on any small object that happen to be in their foveal vision, while completely ignoring all other objects. Distances can be very difficult for people with this disorder to judge, and Balint's can easily be confused with other vision disorders because it is so rare and doctors rarely see it. Alright, one other case study detailed in Chapter 4 is Heinrich Kluver and Paul Busey. They wanted to find out how animals would act in different situations after their temporal lobes had been removed, containing the what pathway. Animals are capable of walking around and navigating without running into walls, but if they are given a razor blade or lit match, they will eat it. They're unable to tell food from something that may harm them. They are also not capable of discriminating between different kinds of animals, such as monkeys, cats, humans, and they will try to have sex with any of them. They also have problems knowing and understanding what prey is or an object's significance. So as one might guess, this could create a serious survival problem for any animal who happen to have their temporal lobes damaged. Alright, this condition is now called the Kluver-Bucy syndrome for humans who have suffered from temporal lobe damage. This can happen a number of ways, including temporal lobectomy, which does not occur any longer, but there were some documented cases back in the 1950s, as well as stroke, Alzheimer's, tumors, and anoxia, as well as some others. Symptoms include putting anything in their mouth, displaying indiscriminate sexual behavior, hyperorality, which is the fascination with examining things with the mouth, docility, including diminished fear response and lack of aggression, and also visual agnosia, which is the inability to recognize objects or people. Alright, and I'm going to finish with a case study of Diane Milner, who experienced carbon monoxide poisoning, and she was rendered completely blind. However, she was still able to grab objects and properly orient them to fit through slots subconsciously when tested by experimenters. As discussed in Ramachandran, her zombie corresponded to the how pathway, which was still largely intact, and Diane responded to the what pathway, which was badly damaged. Diane can interact with the world spatially, but she is not consciously aware of the shapes, locations, and sizes of most objects around her. Her what pathway was not completely damaged, and she was still able to distinguish colors and visual textures. This brings up an interesting theory that there might be within the areas constituting the what pathway finer subdivisions concerned with color, texture, and form. And in this case, color and texture cells might be more resistant to carbon monoxide poisoning than the form cells. Alright, so